Hi, my name is Brooke Locken, and I am here today to present my interview with a family nurse practitioner. So, the first question I asked was to describe your current position and previous experience. The response I got was that I currently work as a family nurse practitioner in a local clinic serving a diverse, underserved population. Prior to becoming an FNP, I worked as a registered nurse for over 8 years in various settings. These settings included med-surg units, urgent care, and a primary care clinic. These experiences helped shape my understanding of patient needs across the lifespan and in different care environments. Next, we discussed why she chose to become an FNP. My decision to become an FNP stemmed from my desire to provide more comprehensive care and address the barriers many patients face in accessing quality health care. Personally, I come from a rural background and saw firsthand how limited healthcare resources affected outcomes. Professionally, I earned my BSN and worked in various clinical settings before pursuing my Master of Science in Nursing, specializing in family practice. My goal was to expand my scope and positively impact health at both the individual and community level. So then I asked if she always knew that she wanted to be an FNP. The response I got was that initially she wanted to work in healthcare but wasn't quite certain about becoming a nurse practitioner until she had gained several years of bedside nursing experience. Over time, she realized that she wanted to be more involved in diagnosis, treatment planning, and preventative care, roles that are central to being an FNP. Next, I asked her to describe the education and experience required for the current role that she has. The response I got was that I obtained a Master of Science in Nursing with a family nurse practitioner focus. This included both advanced didactic coursework in pathophysiology, pharmacology, and diagnostics, and many clinical practicum hours. The program prepared me to assess, diagnose, and treat patients across the lifespan, and it also strengthened my ability to think critically and apply evidence-based practices. The next question I asked was, what were your professional goals prior to your current position versus what are they now? So prior to this role, her goal was to become a competent, confident FNP, capable of independently managing patient care. She said that was all she wanted to do, was to keep her head above water and feel confident in the work that she was doing, which I can definitely relate to, feeling that may be my goal when I finish school. Looking ahead, she aims to obtain a Doctor of Nursing Practice degree to further her leadership skills and potentially engage in health policy advocacy or teaching future nurse practitioners. How have you continued to grow? Was the next question I asked. I actively pursue continuing education through online courses, conferences, and workshops. I also maintain certification with the American Association of Nurse Practitioners and regularly engage in peer collaboration and journal reading to stay updated on clinical guidelines and innovations. So next, we discussed barriers and how they were overcome. The response I got was that yes, she had faced financial challenges while pursuing graduate education and often had to work part-time while attending school full-time. I could definitely relate to this response, as I am currently doing the same thing. She also discussed navigating self-doubt during the transition from RN to NP. Support from mentors, scholarships, and staying focused on her goals helped overcome these barriers. When asked if she sees herself making an impact, the short answer I got was absolutely. She has had many times and many moments where she felt that she was helping make a difference in the community, even if it's just helping reduce wait times to get in to be seen by patients. Then I asked if she had a mentor as she moved into this F&P role. The response that she gave me was yes. During her clinical rotations, she had a preceptor who was both experienced and encouraging. She helped me transition from thinking like a nurse to thinking like a provider, emphasizing clinical reasoning, patient education, and confidence in decision making. Her support was instrumental during her early practice. I am definitely hoping after school I can find someone that helps me, or during school, mentor transition into that role. When asked what advice she has for current or future D&P students, the responses she gave were great. Stay organized, be open to feedback, and find a strong support network. The D&P journey is rigorous but rewarding. Don't hesitate to reach out to mentors and peers, and remember to prioritize self-care to avoid burnout. I asked if there was anything else she'd like to tell about her current professional role, and she told me that being an F&P is incredibly fulfilling. It allows her to form long-term relationships with patients, advocate for community health, and continually grow as a clinician. It's a career that demands both compassion and critical thinking, and she's grateful for the opportunity to serve in this capacity. So then let's go beyond the interview, where we talk about perceived expectations versus the responses that I got. Reflecting on this interview, many of the responses I got aligned with my expectations for my own future role. For instance, I also envision working in a primary care setting that serves vulnerable populations, and I aspire to develop long-term therapeutic relationships with patients. The emphasis on education, evidence-based care, and the importance of mentorship mirrors the values I hold for my career development. There were also parts of the interview that I am anticipating but haven't had to fully go through yet. The emotional and financial challenges of the F&P educational path and the initial self-doubt during the role transition were insightful. Thankfully, so far, I have been able to use the support of scholarships and financial aid and haven't quite had the self-doubt as I am in the beginning of my F&P journey, but I'm sure it's to come. Knowing these barriers exist helps me prepare mentally and seek out resources like mentorship and financial planning ahead of time. Additionally, the interview reinforced the importance of lifelong learning and professional development. I had expected to attend continuing education, but hadn't considered the frequency or depth of involvement in professional organizations and community initiatives that the F&P described. Ultimately, this interview affirmed that my professional goals are well aligned with the realities of the F&P role, and it highlighted the importance of resilience, mentorship, and dedication to patient advocacy as I move forward on my journey. Thank you for listening to my interview. I hope you have a great rest of your day.